So good afternoon, I'm Dr. Alma Nenshi, and I am here once again to do our Wellness Wednesday workshop. And today's topic is treating neuropathy. So I'm going to spend some time talking about what neuropathy is. We're going to talk a little bit about some of the things that you can do at home to help you with your neuropathy symptoms. A little bit of a bio on me. I graduated as a chiropractor back in 1997, so I've been in practice for a long time. And I am practicing much differently today than I did when I first graduated because I had some family emergencies and situations where I had to become very well versed in how to help heal challenges with the central nervous system. My daughter had an eye issue, which helped me understand how the neurology of the cranial nerves work. And from there, I expanded my knowledge base and took several years of training after I became a chiropractor. And then in 2014, I was privileged to be a candidate with the American Chiropractic Neurology Board to write their neurology examinations, and myself and one other person here in Calgary both earned our diplomates in functional neurology, which are which is an American designation. And that was in 2014 at a time when there were about 13 chiropractic functional neurologists across Canada. So I am very interested in anything that has to do with the brain and the central nervous system. And I think that information is powerful. If we have an ability to change small things in everyday life, then we have the ability to heal from the inside out, as long as we are able to remove stress from the systems that are affecting the delicate nerves and brain tissue inside our bodies. So that's what my premise is when I help patients in the clinic. And so I hope that you'll be able to get good information here that you can apply as soon as the webinar is over, and how you can change your lifestyle and some of the things you eat and other exercises and things that you can do to improve how well your central nervous system is working and your peripheral nervous system as well. So what is neuropathy? Neuropathy is a term that refers to malfunctions or the general diseases that occur within the nerves. And the nerves and the nerve endings are all over the body. And neuropathy can be experienced by a huge variety of different locations and types of nerves. And the diagnosis and treatment will be depending on the nerves that are affected and their location. So neuropathy itself can also be classified according to a disease that's causing it. So for example, if you have neuropathy as a result of arthritis, it could be called arthritic neuropathy. If you have neuropathy as a result of diabetes, it could be called diabetic neuropathy. So the term pathy, P-A-T-H-Y, is pathology. Neuro is the nerve, so neuropathology is neuropathy. And then you isolate it to whichever nerves are being affected. Many people are not aware of the debilitating effects of chronic pain like neuropathy can have until it becomes a real issue for them personally or for a loved one. And I'm hoping that you'll be able to understand things a little bit better with this presentation. One of the things you'll see, just going to bring the screen down a bit here. There are different types of nerves in our body. So we have what are called motor nerves, and motor nerves are associated with movement. So I'm going to use my motor nerves to signal my biceps muscle in order for me to contract it and be able to move my arm. So those are motor nerves. They're associated with all of the muscles under your conscious control. So anything that is used for walking and grasping things, or even talking, is used by muscles that are contracting as a result of information from the motor nerves going straight to the muscle to ask the muscles to contract. Now, there is information going from sensory nerves, and sensory nerves transmit information about sensory experiences, such as light touch or pain from a cut or anything that you have in your external body that is related back to the brain. Those are called sensory nerves. So motor nerves send signals from the brain out to the muscles, and sensory nerves send signals from the muscles and organs and systems in the body back to the brain. So they bring information to the brain about the sensory experiences. Autonomic nerves, these regulate biological activities that people don't really control consciously. So breathing, your digestion, your cardiovascular system where your heart is beating regularly, the glandular functions that we have where we're secreting substances, hormones, all of these are controlled by autonomic nerves, which send information to and from the brain to all of the organ systems that are responsible for helping these automatic functions in the body. Okay, so some neuropathies may affect one type of nerve, some neuropathies may affect all three types of these nerves. And usually medical professionals will use neuropathy as a general classification to say that all the nerves are affected. Okay, it doesn't really matter which type. But if you want to go into the specifics, you can have a predominantly motor neuropathy where most of your physical abilities or movements are affected. You can have a predominantly sensory neuropathy. It's very common in diabetes, for example, where the ability to feel things in the distal extremities is compromised. You can have sensory motor neuropathy, so it's affecting both the sensory and the motor nerves. And then you can also have what's called autonomic neuropathy, which could be affecting all of the nerves, or a segment even of the nerves that are affecting your autonomic nervous system, which is all of the biological activities that are not controlled consciously. Again, breathing, digestion, cardiovascular system, all of that. Okay, so I hope that is clear in terms of the anatomy. So let's talk a little bit about peripheral neuropathy. So peripheral neuropathy is actually the most widely experienced type of neuropathy. So peripheral neuropathy is also referred to as peripheral neuritis. And if you remember in our previous workshops, we've talked about this term neuritis or itis. Anything that has itis in it is usually an inflammation. So a neuritis or neuritis is inflammation of the nerves. Arthritis is inflammation of the bones and joints, which is arthro. So peripheral neuropathy is also called peripheral neuritis. And it can be experienced in the extremities because these are all nerves that exit out of the central spinal cord out into the periphery. So they're most likely experienced in the extremities, and they're directly connected with the peripheral nervous system. So the areas that you'll see are the hands and the toes and the feet, the fingers, the legs, skin, and also the arms. Okay, so a person who's suffering from peripheral neuropathy will experience discomfort in these areas, and it may have varying intensities of pain. You might feel tingles with heightened sensitivity. You might feel numbness. You might feel weakness. Remember, the peripheral nerves have sensory and motor components to it, so depending on which part of the nerves are actually affected, that's where you would be able to tell from the symptoms. And the information, again, from the sensory nerves come from the extremities and outside back centrally to the brain. So that's the brain sensory information in, and then motor output from the brain comes out to the extremities. So it could be sensory or it could be motor. So the potential of peripheral neuropathy, like how bad it can get, it can develop, it can vary based on the nerves and how much of these nerves are damaged, okay? There are several things that can cause peripheral neuropathy to develop, and these are usually, but not always, linked to an existing illness. So peripheral neuropathy can result from traumatic injury. So if you, severed a nerve, you damage the nerve, and so anything that's distal or away from that nerve is supplying can be affected in terms of its function, okay? You can have infections that can run in your body that can cause damage to the layers of fat that sit around the nerve and can also damage the nerve itself. So infections, metabolic problems, because you can have inflammation that's running through your body. And when you have chronic inflammation in your body, that can cause problems with the nerves. There are inherited causes that could be the reason why people have peripheral neuropathy. Exposure to toxins, peripheral neuropathy is linked to higher levels of alcohol consumption and cigarette smoking, and especially those who are over 40 years old. So because of the wide variety of causes and the huge amount of nerves within the body, which can be affected by peripheral neuropathy, it can be quite difficult to treat. And some patients can respond differently to treatments, and some people may not respond at all. One of the things that I really pride myself in our practice here is we have equipment and tools that we use that most other clinics don't have in Calgary. And the reason for that is because I search far and wide to try and get unique therapies in our clinic that you can't find anywhere else. I want to help people with problems who have not responded with just traditional medical methods. There are doctors that refer to me. There are patients who refer their friends and family to me, who are treated by other practitioners and have reached a plateau, and they just need that little bit more to get that edge, or to, they might be 40 or 50% function has resolved, but there's still a large amount of work that needs to be done, and those are the people that can come here and we can help them. So while this isn't something that I planned on doing to talk about the various therapies that we have in our clinic, for those of you who are on this webinar or anyone who's listening, I encourage you to call the office and we can have a phone consultation where we can discuss your specific challenges. Because peripheral neuropathy is so widespread in terms of the different ways it can affect our body, it's hard to talk about the treatments for that from a clinical perspective in a workshop. So today I'd really like to focus on some of the things that you all can do from home to help you with your peripheral neuropathy, but know that I'm here to help you from a clinical perspective if you want more information about some of the things we do that help to really reduce inflammation on the nerves and reduce a lot of the pain and other neuropathy symptoms that people have, okay? So, so I have a chat box that if you have any questions as we're moving through the workshop, please feel free to put them in the chat, and then we'll be able to cover those questions at the end of the presentation. All right. So we talked a little bit about toxins and how toxin exposure can cause damage to the nerves. And, there are a lot of people who suffer from chemotherapy-induced neuropathy. And this is a very serious form of neuropathy. Most people just wait it out, and as the chemotherapy starts to detoxify naturally out of the body, there's less exposure to the toxins from the chemotherapy. and then the nerves can start to slowly regenerate. The challenge is the longer the nerves are affected or compromised, the longer it takes to get them back. And so if we wait for, just letting time take its course, sometimes people won't get that nerve function back completely. So after your chemotherapy is completed, and that your doctor has given you the okay that you're cancer free and everything is working really fine, you're in remission, and now it's a matter of your body starting to heal, there's lots of things that can be done to try and encourage these nerves to wake up and start working better. Okay, and we have patients that are using certain therapies in our clinic that are trying to wake up the nerves from chemotherapy. So over the course of treatment, many cancer patients will develop symptoms of neuropathy in direct response to the drugs that are administered during chemotherapy. And certain types of chemotherapy will affect the small sensory nerves that connect the spinal cord to the muscles, and especially when you've got the smallest nerves in your fingers and in your hands and fingers and your feet and your toes. Those are the nerves that are going to be affected first, because those are the nerves that are most vulnerable to these toxins because they're so small. So symptoms such as numbness and tingling, pain in your fingers and your toes. You can also get weakness in the muscles as a result of the motor aspects of these nerves being affected. And also there can be muscle damage from areas of the body that might have had to be surgically treated because of the cancer that might be there, and then the chemotherapy on top of it. So, I mean, you have to save your life first. So you do what you need to do in order to get rid of the cancer, and then we can work on the fatigue or the cramping or the weakness or the pain or the numbness or whatever it is that you're experiencing after chemo. So there is a very tough extended recovery period for people who endure chemotherapy, and the severity of the neuropathy experienced is actually, it continues to increase as the treatments, the chemotherapy treatments progress. But then again, once the treatments have completed, you have a chance to get some of that nerve function back. And because there are already a high level of medical substances already within the body as a result of the chemotherapy, it's really important to make sure that from a medication, nutritional perspective, you want to be able to be very clear on the things that you take into your body, because you don't want that to affect or impact the success of the chemotherapy that you've elected to take. So there are certain things that you should not be ingesting when you're on chemotherapy, and we want to make sure that you're really clear about that with your medical doctors, with your oncologists. And then after all of that is done, we can certainly look at some of the other nutritional things that you might want to include. Natural approaches to easing neuropathy are more favorable, such as exercising or generally having your antioxidants, your key vitamins and minerals, maybe some herbal supplements. Again, these are all after the chemotherapy has been completed. And we'll talk a little bit about that when we get into that part of the workshop. So we also have what's called diabetically induced neuropathy. And this is actually the most common cause of neuropathy. So high blood glucose levels and a high level of fat, which is associated with diabetes, can impact nerve functionality over time. And the symptoms can vary depending on what area of the body this manifests in. So many diabetics experience either muscle pain or nerve pain, and it's important to differentiate between the two before diagnosing neuropathy, because neuropathy is a nerve problem, not a muscle problem. Now, the muscles get involved because the nerves are your connection from the brain to the muscle, but it's not an actual muscle problem. It's actually a communication problem with not being able to signal the muscles properly. So around 60 to 70% of all diabetics will experience some form of neuropathy. And because the neuropathy is systemic in your blood, it can affect any one of those four nerve types. About 1/3 to 1/2 of these will experience the peripheral neuropathy. And the good news is it can be treated, it can be erased, or it can be eased with regulating your blood sugar and, you know, returning your blood sugars to a healthy level and keeping them there is the key to minimizing the discomfort with diabetic neuropathy. And also you need to be, you know, understanding that, you know, if you're aware of the benefits of physical activity and what you should be eating, you can eat energy-rich foods that aren't loaded with sugars and carbohydrates, and that won't affect your blood sugar levels as much as other foods that might be a little bit more convenient. So let's move on to some natural treatments for diabetic neuropathy. You know, when people take nutritional supplements, here's a concept that some people may not be aware of, that a nutritional supplement is an outside-in approach for helping your body, okay? Some people can take a look at in a health food store, for example, and pick out 20 different bottles of different supplements that they think that they need based on specific functions that are challenging in their body. I really warn you against that because just like other toxins, if you take a supplement that your body doesn't need, it will regard it like a toxin and then have to work extra hard to get rid of that supplement out of your body. So for our patients, when they come in, if they have nutritional supplements that they would like me to check, we actually have a way of looking at all of your supplements and being able to, you know, hone in on only the absolute few that your body need, rather than taking a whole bunch of different supplements hoping that, you know, you'll be able to get a little bit of everything. So I caution you, when you do take supplements, don't take a whole bunch of them. Make sure you have someone like myself who can take a look at your supplements and guide you on which supplements you absolutely need and which ones you may want to lay off of, because taking too many supplements can actually be toxic in your body. It loads up the, you know, it puts stress on the liver to now have to get rid of what your body doesn't need. So please limit what type of supplements you take and how many you take, okay? But, you know, one of the things that you can do, especially for diabetic neuropathy, is limit the processed and inflammatory foods that are in your diet, right? So when you are able to reduce your level of inflammation in your body, that will help to balance out your blood sugars and your hormones. So you may want to get yourself tested for food sensitivities, because sometimes people have inflammation in your body as a result of food sensitivities. And even if you don't actually go to get allergy testing done, that's not necessary. You will know based on when you eat a particular food whether it agrees with you or not. And then those foods that don't agree with you, you should, at a time when you have neuropathy symptoms, you may want to not eat those particular foods because you don't want to add an extra degree of inflammation in your body. So take a look at what foods you are sensitive to. Maybe put those aside while you're trying to treat your neuropathy symptoms, and then we can reintroduce those in a controlled way if you would like them back into your diet, and I can assist you with that if you like, okay? So the biggest thing with diabetic neuropathy, if you want to see improvements in that, exercise, 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 okay? We need to work on trying to increase the insulin receptor site sensitivity. This is the area of the cells that are looking for sugar as it passes through the bloodstream. And we need to make sure that all your cells and your cell membranes, where all of these different receptors on them, are all working really well. And exercise is a great way to improve function, and it's free. It's right there at our fingertips. You know, you can go for a walk, you can even do it in your basement. It doesn't matter what you do, you just need to get things, you need to get your cardiovascular system working. So it could also be just running up the stairs in your home, or even walking up the stairs in your home. But you just need to get your cardiovascular system up and working better. And exercise, another benefit for it is reducing stress. Think about how many conditions in the world right now are caused because of stress. Like over 90% of all healthcare dollars are trying to treat things that are caused by stress. If we are able to reduce stress in our lives, that's going to be the biggest thing that we can do to try and help control the inflammation and help our bodies get better interconnected. So think about what you can do to become more active. Think about the foods that you're eating. Eat those foods that are rich in nutrients and don't have a high glycemic index to them. And then also exercise and reduce your stress. So those are the main things for diabetic neuropathy, for all neuropathy really, okay? So insulin and neuropathy. So insulin is one of those hormones that we actually can control. And that's what makes it hugely influential in our level of health, or if there's an imbalance in disease. So the food that we eat is ultimately responsible for how much insulin is circulating in our body. And it's so vital that we gain an understanding of our own insulin levels and requirements before we start treating. So one of the things that you could do is try and regulate your blood sugar with your diet. And some of the foods that you can consume that are helpful in regulating insulin are high fiber foods. So foods like whole grains and vegetables and beans, protein-rich foods and snacks, healthy fats, and then have regular meals. Small meals multiple times a day is better than having 2 big meals in a day. So we want to be able to have a little bit throughout the whole day so that we're able to consume a regular amount of food and that our insulin levels stay pretty balanced. Okay. So there are certain nutrients that can help you fight neuropathy. And I'm just going to go over a couple of these here. We talk about potassium and magnesium. So potassium and magnesium are 2 nutrients that are essential for proper nerve function, because nerves transmit messages using the energy generated by potassium in the cells. And it's used, if you remember back in grade school when you learned the Krebs cycle, you learned about biochemistry and the sodium-potassium pump. Potassium is critical for making energy, okay? And magnesium helps to calm overactive nerves that are hyperfiring. It helps to calm down the central nervous system and relaxes the muscles. So this relaxation will help both the nerves and the muscles to regain strength and mobility, and then that will help to reduce pain. So low levels of potassium, magnesium may result in fatigue or cramping, weakness, or exaggerated symptoms. And potassium-rich foods include bananas, sweet potatoes, squash, beans, avocado, and spinach. Okay, so those are a few things you can include more into your diet to help you with your neuropathy. So again, when we're talking about increasing your natural acids, you know, one of the things that is important is alpha lipoic acid and gamma linoleic acid. These are all research supplements that have a positive effect in treating diabetic peripheral neuropathy. So ALA or GLA are the short forms that you might see on your nutritional supplement labels. So ALA protects the microcirculation. So this tiny little blood vessels that go and innervate the peripheral nerves. Remember, we have nerves that are going to all of our muscles, but the nerves themselves also need oxygen to work. So there are small little tiny blood vessels that actually supply oxygen to the nerve. And so the alpha lipoic acid will help to protect that microcirculation that brings oxygen to the nerves. And over the course of long-term treatment, that can be over several months. Some participants in one study that was done by the Alternative Medical Review talked about how these participants experienced a reduction in symptoms and better blood flow. Okay. So there's another naturally occurring amino acid called L-carnitine, and it's also known to benefit neuropathy symptoms. So it contributes to regrowing and strengthening nerves and the surrounding cells. So that is something that helps to influence neurotransmitters in the brain. And also acetylcholine and dopamine have also an effect on the brain. So it boosts your mood as well. So that's L-carnitine, or if you'll see ALC is another abbreviation for that. So we talked a little bit about food sensitivities, and there's so many correlations with what we eat and physical pains or imbalances that we experience. So the single most important factor in our day-to-day lives is that we can really focus on improving neuropathy naturally if we just clean up our diet. And I mentioned a few foods earlier that you can have. But again, if you do have food sensitivities or allergies, you may not just have the obvious symptoms like breaking out in hives or skin rashes or things like that. It might be more subtle, such as, maybe some gas or bloating when you eat a particular food. You just don't feel like you're able to have regular digestion, or maybe you got too fast rapid transit through your digestion or through your gut. There's so many different things that can affect your overall digestive health, and when you eat something, whether it agrees with you or not. So I just want you to pay attention to food sensitivities. If you're eating things that you're sensitive to, you're just increasing inflammation in your body, and that's not a good thing. Vitamin B1. Did you know that vitamin B1 is one of the primary sources of fuel in our nervous system and our muscular systems? It is a really critical vitamin, and it has two important roles. Number one, it helps to convert carbohydrates into energy so that the nervous system can use it. And number two, it helps in making ATP, which is your little energy bundles that the mitochondria in your cell create. And it's a molecule that's used by every cell in the body to transfer chemical energy between cells for your metabolism. And the biggest problem with vitamin B1 is that our systems have a difficulty in absorbing it when we try and consume it through food sources. So only a small fraction of what we eat that has the B1 in it will be absorbed into our body through our diet. So this is one supplement that I would recommend if you have neuropathy. Consider taking a daily vitamin B1 supplement in addition to eating B1 rich foods, because B1 is a vitamin that's not easily absorbed into our body. And top food sources for vitamin B1 include sunflower seeds, navy beans, black beans, green peas, and lentils. So how are we doing so far? I mean, we're about halfway there. I know we've been talking for a little bit. If someone wants to give me a little message on the chat to give me any information there that you would like to see extra than what we've been covering, or just a little thumbs up or something to let me know we're on track. I have a lot of people on this website, or sorry, on the webinar right now, and it's hard for me to interact with each of you individually. So if there's anything that you want to contribute in the chat box, that would be great. So let's move on to vitamin B12. Now this is another key vitamin that can help us heal damaged nerves. And it's really crucial for preventing neuropathy. So foods with vitamin B12 contribute to repairing and maintaining nerve cells. And in particular, you're looking at that fatty tissue that surrounds the nerve. Now, the fat that sits around the nerve is what allows those electrical signals to just go boom, 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 and glide right off, and you get fast signaling when you have a lot of fat around a nerve. So that B12 is important to try and repair and make sure that that myelin sheath, that fatty tissue around the nerve, is nice and healthy. So we need that. One thing that happens when you have nerve damage is that myelin sheath that covers the nerves. It's kind of like insulation around a wire. You know, that rubber that sits around an electrical wire that protects it. Well, it's almost like it starts to deteriorate. And when that happens, the nerves can misfire and trigger other nerves, which then cause aberrant nerve cell activity. So we want to make sure that we have a healthy amount of B12 in our diet. And foods that contain B12 include sardines, snapper, venison, salmon, lean beef, lamb, scallops, shrimp, and halibut. And you should know that B12 is only found in animal products. So people who are following a vegan or plant-based diet might need to get the B12 in a supplement in order to make sure that they are able to have it. Now, the B12 will come from an animal source when you get it in a supplement. So you may want to consider being okay with having that supplement, because you can't get it from anything else. It's just so critical for your nerve health. So that would be something that I would consider doing, even if you're vegan. So think about it, and you can always call me if you want to talk. Nerve damage, we talked about it, happens to the outer nerve myelin core. And oh, you know, I forgot to mention here, there are certain vitamin B foods that are just rich in vitamin B in general. Those are whole grain cereals as well. And again, we're looking at the meats and the poultry, the fish. Brewer's yeast also has it, milk, eggs, legumes, potatoes, and peanuts. So those are all foods that are rich in vitamin B. And so it's not just B12, but just in all B vitamins. So it's good to try and incorporate some of those into your diet. Okay, so lack of B12 can cause a variation of neuropathy. It's called B12 deficiency neuropathy. And it can also impact your level of energy as well. So sometimes people actually get B12 vitamin shots that are injected into your body to try and get that vitamin in and start healing the nerve conduction. And then when you fix the nerve conduction, then you get more energy and more ATP. So other herbal supplements that are supportive for nerve health, St. John's wort. It's a herb that's native to Europe, and traditionally it was used by the Greeks to treat menstrual disorders, snake bites, and wound healing. But we also know St. John's wort has a very powerful antidepressant quality, which helps to soothe nerve pain. People who are in pain for a long time tend to develop a certain degree of low energy and depression. And so St. John's wort is something that may be able to help them. And they're topical treatments with St. John's wort oil that can help to put topically on the area where you have your neuropathy pain. And that might be something you want to consider. St. John's wort has also been used with various degrees with memory. So people who have Alzheimer's and Parkinson's and addictions and memory impairment or brain injury. So that would be another function of that if that is something that is affecting you. Antioxidants. So foods that are rich in antioxidants are hugely beneficial in treating chronic pain. They basically fight the atoms that are called free radicals, and those free radicals interact with our cell tissues, and they can cause nerve damage and deterioration in the cells. So free radicals that are synthesized from oxygen are especially difficult to remove. So they not only interact with the cell's tissues, but they also create more radicals as well. So the antioxidants are compounds that are going to neutralize the free radicals that are created from oxygen. So there are various superfoods that have very high levels of antioxidants, and these foods not only heal your damaged nerves, but they may also reduce your risk for cancer and immune diseases, and they also slow the effects of aging. So foods that are high levels of antioxidants, are you guys ready for this? Blueberries, raspberries, blackberries, tomatoes, broccoli, red grapes, garlic, spinach, carrots, pomegranates, dark chocolate, my favorite, and green tea. So enjoy. So cranial neuropathy is something that I see sometimes in my office because we're so focused on, you know, all the things happening with our brain and our central nervous system for people who've had head injuries and physical traumas that affect their nerves. Cranial neuropathy is used to describe, or is a term that's used to describe the form of neuropathy that occurs from the nerves that exit out of the brainstem. And the brainstem nerves go and control all of your face stuff. So cranial neuropathy would be something that is localized to the cranial region. So you can see here an example of Bell's palsy, where the facial nerve coming out just from in front of the ear that supplies all the muscles of the face, when that nerve is irritated or inflamed or is not signaling properly, all those facial muscles become very flaccid. And so it causes drooping of the eye. And sometimes the Bell's palsy is caused by a virus as well, which can be irritating the facial nerve as well. Okay. So microvascular cranial nerve palsy, again, you're dealing with a problem with the circulation that is supplying the cranial nerves, and that can affect nerves in around the eye. It can cause you to have double vision and other problems with eyesight. There's third nerve palsy. The third nerve from our brainstem is responsible for moving your eyes towards the middle. It's moving your eyes up and down. There's all the eye muscles there that can be affected. Most of the eye muscles, except for cranial nerve 4 and 6, which innervate 2 muscles of the eye. The rest of the muscles of the eye are controlled by cranial nerve 3. So if you have a disorder with how that nerve is working, you will find challenges with moving your eye. So you'll get double vision, you'll have difficulty moving the eye, you'll have difficulty reading. You might notice your eyelids start to droop. There are a number of disorders in the brain, such as an aneurysm or tumor, that can indirectly cause third nerve palsy. Diabetes and migraines are also potential causes. So it's a very serious challenge when we're dealing with third nerve problems. The fourth cranial nerve, it is responsible for the superior oblique muscle, which is on the inside of the eye. And so it will also cause you to have some blurred vision, or have you have a problem with depth perception, or, you know, you see double sometimes if you have a problem with that. And treatments for cranial neuropathy are difficult, right? So again, we talked about some diet and exercise things that you could do that might be helpful. best thing is get in touch with your doctor. You know, you can come in and see me. We can do a complete cranial nerve exam. We can figure out what nerves are affected. And I can tell you some of the things that might be able to help you, or if your condition needs to be referred to get extra special imaging. But there's lots of things that can be done to help heal nerves, and I can help you with that if you like. So acupuncture, I've been doing Chinese acupuncture ever since I graduated back in '97. So that was one of the other areas that I trained in when I got my chiropractic degree. And acupuncture is a very natural way of treating to ease symptoms of neuropathy. It's very effective. In my clinic, what we do is we basically remove the needles and we use a laser, and we do laser acupuncture on it. So it's a little bit more comfortable for our patients. It's hard to insert a needle into an area that is so painful. So I don't want to do that. So I use lasers that help to identify those acupuncture points, and we're able to do laser acupuncture and stimulate those meridians. And then I have a variety of other technologies that also work. So acupuncture helps to increase endorphins into the central nervous system, and those endorphins basically help to reduce pain that you're feeling. So there's also alcoholic neuropathy, and just as the name describes, it's something that is caused because of excessive consumption of alcohol. Alcohol is poisonous to the nerves. Not only does it affect the nerve health, it also affects your cardiovascular health as well. And symptoms that you'll see are numbness, lack of feeling in the extremities, especially in the smallest muscles in your hands and in your feet, muscle weakness, very highly sensitive to things in your environment. So like something light can just brush on your skin and you get pain. Balance issues and coordination are huge. So treatment for alcohol neuropathy, you know, firstly, just detox the system from the alcohol, right? Let's try and get rid of the alcohol out of the body and replace that with better nutrients and vitamins that can try and reverse the damage caused by the alcohol. Environmental neuropathy. So as with many physical and mental illnesses, the importance of having a healthy environment to establish a baseline healthy state of homeostasis in the body is huge. So look at your environment and try and get rid of physical toxins, right? Substances such as mercury and lead and arsenic and thallium can all cause neuropathy symptoms when people have long exposures to them. So industrial toxins in your workplaces, there are organic solvents, there are insecticides. You know, they call them herbicides. You know, an herbicide's going to be sprayed on your grass in this particular neighborhood. Well, they're still toxins, right? It just, you know, they try and make it sound a little bit healthier when they call it an herbicide. It really is our toxins. So there are a lot of harmful substances that everybody is in contact with and working within. So take a look at what you're surrounding your environment with and see if there's a way that you can reduce the exposure to these toxins. And yeah, I think that that's something is really important. Recreational drug use can also over time be a toxin as well. And, you know, just like smoking, it can cause problems. An easy way of helping to soothe neuropathy from any type of drug use might be through using hot or cold packs or hot and cold soaks, some very light massage on the area. You can just take some lotion and just start gently rubbing the areas that are compromised. Again, we're trying to bring good circulation to the area so that you're bringing healthy oxygen. If you're smoking or you're drinking or you have some other toxins in your environment, it's hard to provide an environment for those nerves to heal. So again, look at those antioxidants and the nutritional and dietary recommendations and get active, start moving. Arthritic neuropathy arises as a result of severe arthritic symptoms. And, this is actually quite difficult because once you have arthritis and you have joint pain, such as from carpal tunnel, or you might have some issues with your spine, it's really hard to reverse that. Once you have the arthritis, it's there. So you can get arthritis, which is again inflammation of the joints. You can get arthritis from autoimmune disorders such as rheumatoid or lupus or other things that are systemic in the blood. And those types of arthritis are circulating in all of the body. So you can get pain and swelling and stiffness in all the different joints, versus you can get arthritis in a local area, such as, let's say you get arthritis in your wrist, and that might be just causing pain in your hand. So we have to be able to isolate where the arthritis is coming from and what the causes of that arthritis is in order for us to understand how to treat the neuropathy from the arthritis. But most of all, what you can do is follow an anti-inflammatory diet. Okay, so reduce your blood sugars, avoid alcohol and smoking, regular exercise, take B12 supplements. Some natural essential oils that can help could be lavender and chamomile and primrose. Those are all essential oils that can help to calm down the sensitivity of the neuropathy. Okay, so hopefully you are not suffering from this form of neuropathy, but unfortunately in my practice, many of my patients have nerve pain that are related to arthritic and other problems in the joints. And so that also affects their strength. And when they get their chiropractic adjustments, we always do a pre and post assessment of how strong their bodies are before the adjustment and then after the adjustment. And most people are very surprised at how much power they have within themselves if we can just remove the stress off of those nerves. And so that is really exciting. I get to see that day to day in my office. So gluten intolerance and neuropathy, there is a correlation between gluten intolerance and neuropathy. And it's quite interesting. The intolerance to gluten is typically understood as a chronic autoimmune or inflammatory disorder. So the body is just not able to process certain types of gluten-containing substances in food. Now, there are other systems in our body, such as our thyroid gland, that has proteins in it. And the proteins in the thyroid gland are very similar in composition as the gluten molecules. And so they look like relatives. So when the body is attacking gluten, sometimes it will start to attack other areas of the body, such as proteins in our thyroid and in our brain that have similar compositions. And so gluten is one of those things that if you take out of your diet, it can help to calm the inflammation down in your body. And it might also reduce the amount of autoimmune reaction your body has in attacking the thyroid, leading to Hashimoto's, for example, or even attacking other central nervous system proteins. So we want to make sure that if you do have an intolerance to gluten, there is no minimum level of gluten-containing substances that you should be eating. It's just take it out of your diet completely. And those of you who have gluten sensitivities, you know how hard that is because everything has gluten in it. So it's very challenging, but it can be done. And certainly we can help you with that if you like. So inflammation in the joints from gluten can cause inflammation in the joints, which can be responsible for stiffness and arthritis. Gluten can cause inflammation in the lungs and the nasal passages that can cause respiratory congestion or asthma and chronic cough. Inflammation from gluten can be caused in the membranes of the brain that can lead to headaches and migraine. Inflammation in the nervous system that can cause neurological disorders such as multiple sclerosis and epilepsy. And then again, when you have inflammation in the body, you can get inflammation in the skin, such as with hives and eczema and psoriasis. So gluten intolerance or gluten intolerant related neuropathy is like so many other physical illnesses. It can be traced back to inflammation as the root cause. And I just have to say, we have technologies in our office that help to reduce inflammation. So one thing is to avoid what's causing the inflammation. The other thing is to get rid of the existing inflammation in your body as well. So there are ways to help you do this. And certainly diet and exercise and all of that is important. But if you have these neuropathy symptoms, I really encourage you to consider getting a consultation and figuring out whether there's other things that can be done to help you, because where you are right now with your life might be okay, but is it going to get worse over time? And where will you be with your life and your body because of all this inflammation, let's say 10 years or 20 years or 30 years down the road? And how is your brain and your central nervous system going to function if you're already led down this path? So really, really important to get that checked out. So sugar is has a huge impact on peripheral neuropathy symptoms. We know that the most common cause of neuropathy, we already talked about that, is diabetes. And it makes sense that the leading cause of that disease is actually sugar because it gets absorbed into the bloodstream. And you don't have to suffer from diabetes for sugar to impact your chronic pain. In fact, you can be pre-diabetic and not have diabetic levels of sugar, but the inflammation that is happening as a result of eating lots of sugar can still cause neuropathy symptoms, even if you don't have the diabetes diagnosis. So please think about removing sugar from your diet. Really important to try and get rid of sugar because it's just a natural thing to do. Like if you're able to get, and it's so addictive. It's so addictive. It's so hard to do that. You'll go through withdrawal for a week or two, I'm sure. And some cases, like for myself, I had migraines for several weeks after, and it can trigger other symptoms that you might not like, and you might say, hey, I'm just going to go back to sugar. But think about the long-term effects that happen in your body as a result of low levels of chronic inflammation. Not good at all. So make sure you try and get rid of as much sugar out of your diet if possible, all of it. Balance issues. 65% of people with peripheral neuropathy, because we're relying on such a small square footage under our feet for holding our balance and our weight, you know, you're going to have a challenge with falls at some point in the future if you're not careful. And over half of the 65% of people who have peripheral neuropathy from diabetes, over half of them are in the elderly. So one of the things that we know is osteoporosis and osteopenia occurs not because you fall and you break your hip. It's because the lack of bone density in the hips causing your hip to fracture, then causing you to fall. So you would think that if you fall, you break your hip, but no, that's not what happens. Actually, people break their hip because of the lack of bone density, and then that causes them to fall. So it's so important that we have enough stability on our feet so that if we have to suddenly change positions or turn or do something really quick where our body has to accommodate to a stress from the outside, that we have the stability in our central nervous system and in all of our core muscles. I'm not talking abdominal muscles. I'm talking about the large muscles in our body, that we are able to shift our body and be able to accommodate to all of the different stresses that we have. So if we have neuropathy, we already are compromising how well we're able to signal those muscles so that they remain strong. So if you have loss of sensation or numbness in your extremities and you don't get the correct responses from the external stimuli, that can cause confusion and can cause balance issues. Similarly, not being able to send signals, motor signals into the nerves and out to the extremities can also impact your strength and movement. So really, really important to make sure that physically you're looking after yourself when you have neuropathy symptoms. So there is some information on how resonance can affect neuropathy, and resonance can come from sound. It can come from instruments such as our frequency-specific microcurrent that resonates at specific frequencies. And the resonance actually goes beyond just relaxing the body, but it actually stimulates healing. So really, really important to look at resonance as a healing method for healing damaged nerves. It can help to stimulate regrowth, and it can reduce inflammation in the area. And again, our frequency-specific microcurrent therapy in our office is geared and focused on using resonance. Just like an opera singer can match their tone in their voice to resonate at the same level as glass molecules that are holding a glass together, when those two waves intersect, because they're similar, it just shatters the glass. Just like when you have a resonant frequency that's going to go and break up scar tissue in the body, it will get rid of the scar tissue and alleviate any stress there is on the nerve, and the nerve can function better. And there's so many different other applications for how that works. So I think that that's really critical. Traditional Chinese medicine, we talked about acupuncture, and there are Chinese herbs that come into play as well. There are many types of herbs and therapies that are available, nutritional therapies that can help to calm down peripheral neuropathies, mainly for treating diabetes, and a lot of it is combined with the acupuncture, or for us, we do laser acupuncture for trying to reduce the inflammation on the nerves, and we can also use the microcurrent for that. Okay, so we're almost done with our discussion today, and I really hope you've gained a lot of valuable insights for the class and what we've been able to accomplish. There's a lot of things that I hope you were able to jot down. If there's anything that you found really interesting, or any type of treatments you think you're going to try, put them on the chat, and I'd love to be able to talk about these after we've finished recording this workshop. So does anyone have any questions or anything that they would like us to address in this group setting? And if not, I'm going to say goodbye for now and be able to reconnect next week. So we're just going to leave the floor open here for you to send me any questions in the chat. Thank you so much for being here. I know that it's really hard to take an hour out of your day and be live with someone. I really appreciate that you've taken the time to be here today. I hope you've learned a lot of information about what happens when you have neuropathy, the importance of having healthy nerves, the different things we can do from diet and exercise that can help calm inflammation in our central nervous system. So important, and I'm so grateful for all of you being here today. Again, this webinar has been recorded. I will post on YouTube probably later this evening, probably tomorrow, because I have another engagement for this evening, so won't be able to do that tonight. But if you know anyone who you think can benefit from this, please share it. And if you are interested in any other topics that you'd like us to talk about, send us an email and we'll be happy to address those. So far, we have workshops every Wednesday at 1 o'clock, right through till the end of July. I haven't made my August calendar yet, so we are open for suggestions for topics in August, but our topics are already posted on our website, calgarywellness.com, and you can certainly take a look at that for more information if you like. So thank you so much for being here today. Really appreciate it. Remember, we've got that another webinar next Wednesday, and I'm going to be closing off here today so that I can take your personal questions. So thank you so much. Have a wonderful rest of the day, and we'll talk about questions now.